Hi, my name is Craig Martin. I'm the head of the employment law section at our firm. As such, I represent both employees and small to mid-sized employers in all kinds of employment matters. COBRA is a federal statute that gives employees certain rights, and it has not really changed under the Act, but as a practical matter, the Affordable Care Act will change how it operates. Under COBRA, any employer with 20 or more employees must offer their employees continued health insurance after a qualifying event. Usually a qualifying event is a termination or resignation of employment. The employer then has to let the employee continue on the health insurance plan, but the employee must pay for their share of that, for all of the insurance. That has not changed. That federal law is still in place. But now there are more reasons why people may not choose to use the COBRA coverage. It used to be there was a good reason not to do that because insurance policies could exclude pre-existing issues. However, under the Affordable Care Act, that is no longer a factor, and so even an employee who is ill can go to the exchange and look for a better policy, and they may choose not to exercise their COBRA rights. If an employer fails to provide the COBRA notice or offer COBRA coverage, there are some fines and penalties that can be imposed, but far greater risk to the employer is they could end up having to pay the medical bills that the ex-employee is incurring because the employee would have had them covered by COBRA insurance and didn't. So it can be a substantial risk if you do it wrong.